I think it's important for people to understand that it is so complex and there are so many different phases of digestion that can be contributing. So it's not just the stomach. We have so many organs at play. We're just thinking of GERD and acid reflux. The main culprit is low stomach acid, lack of mindful eating, and kind of just being in that stressed out state. Those are the three big culprits.
When we do start the medication, it's very important that we also teach them about the nutrition, teach them about the changes they have to make in their lifestyle, teach them about their sleep hygiene, when to lay down after they eat a meal.
It's about you and me. Let's come together, positivity. Health is wealth, gotta take care of myself. Cause ain't nobody gonna make the change but
Welcome, everyone. I am so excited today. We are here at Health Talks by YWS. It is the holidays, we're getting ready for Christmas, and being with a family is something that we all look forward to. Whatever culture we may be from, we look forward to eating all our favorite dishes. Some of us are from Africa, the Caribbean, from the Mediterranean, from Latin America, or even from right here in the United States of America. But food has always been the mainstay for all of us. But we have some problems. There are some times when we have difficulty enjoying our favorite meal. And I wonder what can be the culprit. So let's talk to my co-host, Ms. Tillie Mirsky, and let's find out the culprits for being a damper on the holiday time when it comes to eating.
So the unfortunate thing when we are enjoying these decadent meals, and maybe it's even a meal that feels like it shouldn't cause any symptoms, but unfortunately does. It could be excessive burping, that little feeling of acid reflux in your throat, a little congestion or pain in the chest, such as heartburn. Any of these symptoms relating to GERD or acid reflux are one of the main things we see both during the holidays or just kind of put in a damper on most people's lives whenever they eat meals. It's so common, but lucky for you guys, there's so many ways to remedy and solve the problem.
So let's talk a little bit about what are the symptoms? How do I know that I have problems with digesting my food? So when I think back at my clinic and think about a lot of patients coming in with multiple complaints about digestive problems, it tends to typically be, one, acid reflux. I feel like I can taste my food after 3-4 hours after I ate it. I'm burping. My breath smells quite strong or pungent, almost like a sulfur breath.
Mm-hmm.
It's like a sulfur burp and a sulfur breath. The other thing patients often complain about is just this abdominal bloating, this gassy feeling. It's a feeling like they know they did not eat as much food, but yet their stomach feel quite tight and full.
Mm-hmm. We call this early satiation. And it's when you'll be very, very hungry. You're ready to enjoy that meal. And then you take a couple bites and all of a sudden you're feeling distended. You're feeling that pressure. You're feeling overly full when you didn't even get to complete your whole meal.
Yeah. And that's a lot. A lot of times patients say, hey, I sat there, I look at my meal and I eat a couple bit and I'm feeling full and I don't want to eat it again,
Mm-hmm. And then later they have the symptoms of excessive burping. That's a common one related to GERD and acid reflux. It can also affect your energy levels. It can make you groggy and just kind of feeling sluggish after a meal. So there's a lot of symptomology that isn't even directly associated with the gut, that feeling in the stomach, but yet it's there because of those digestive distress.
And then one of the other things that a lot of patients may complain about is a fluctuation between constipation and diarrhea, or loose stools and having difficulty having a bowel movement. And quite often their first complaint to me would be that I saw blood in my stool. And I'm like, is it bright red blood or dark red blood? And they said, it's bright red blood. I said, were you straining? Were you forcing? And they say, yes, I've been forcing. So that is another symptom patients often come with.
Oh yeah, it's super prevalent. So why don't we just jump in and talk a little bit about what acid reflux is, what GERD is? Obviously, we just went through a lot of the symptomology, but Dr. George, do you just want to explain kind of the mechanisms behind it, the medicine aspect?
Normally, when we think of our digestive tract, we think about when we chew food, our bodies, our mouth, we're going to release saliva from our saliva gland. And that helps to break down the food as you chew it with mastication. It forms a bolus called chyme. And chyme goes down into the stomach. And in the stomach, there we have hydrochloric acid released from the goblet cells that is released from the proton pump on the walls of the cell. So these hydrochloric acid helps to break down the food. And as it further breaks it down, it goes down to the pyloric sphincter. That pyloric sphincter is where that muscle is. It opens up so the food bolus could go down and then it closes off. And then after that, it goes through the small intestines, the large intestines, and also goes to the liver, the bile duct to break down the minerals for reabsorption, and all that great stuff occur. But sometimes the changes that happen with our acid reflux is that we change the pH of our body. So that's the first step where we may have low acid being formed. And Miss Tillie is going to talk more about that in a little bit. Or sometimes stress or stress hormones. Once cortisol is released, we end up causing a disequilibrium or imbalance in our body with our hormones and what is going to be released. The other biggest thing that we need to understand, when stress occurs, we do have stomach and gut problems. And the reason for that is that 75%, at least 75% of serotonin receptors lies in your gut. And this is why anytime you're nervous, you're about to take an exam, or you're very stressed, this is why the first disruptive symptom you have is either stomach pains, stomach cramping, or you're running to the bathroom because you have loose stools. And all of that has to do with the stress response related to the serotonin receptors. Then the second part we have is that we can have a mechanical problem. Structurally, something is just not working well. So maybe the sphincter is not completely closing and food is backing up into the stomach from the small intestines. Or maybe your stomach is not learning how to shut off those goblet cells that is releasing the hydrochloric acid. So there are different stages of your body that can cause a structural dysfunction or a functional dysfunction. Once we start with that, then we have to think about how do we make it better? Because here it is, you're having belching, burping, food is not digesting. There's a lot of hydrochloric acid being released into the stomach, more in excess than what should be there, just enough to break down the food. So when you think of how our body operates, is that there is food that coming down through the esophagus into the stomach, and then our body gets a trigger that, hey, we need to create this hydrochloric acid to break down that food that's coming, and our body prepares for digestion. But what about when there's no food in the stomach? When there's no food in the stomach, hydrochloric acid should not be released. But in a stressful environment, during a stress response, hydrochloric acid is being released and there's no food for it to work upon. And sometimes that can be very erosive to the lining of your stomach. This is where people eventually develop ulcers in the stomach, because there's hydrochloric acid just being released and there's no food for it to be on. So it's almost like having an open wound, Miss Tillie, and just dropping acid on it. That's what it feels like.
Yeah, that's a perfect description.
So what do we do? Sometimes our treatments, when a patient come in, we might try to help to create more of a pH balance so that they don't have that acid taste or that burping. Sometimes we tell them to avoid certain foods. Some of the foods we tell them to avoid: caffeine, carbonated drinks, We tell them to avoid eating and laying down immediately. You want to eat and wait at least 3 hours before laying down. We often tell them, avoid alcohol, minimize it as much as possible. Avoid tomato-based foods, things that are spicy and saucy, So these are some of the things. But one of the biggest thing I think, Miss Tillie, that we as a professional, we always rushing, because we're seeing patients, we're trying to get lunch in between, and we don't have the luxury a lot of times of a full hour lunch. We don't have that. So one of the things that can be the culprit of causing this acid reflux is eating in a rush, because you end up chewing and swallowing instead of really chewing. According to scientists, they say you should chew a mouthful of food for 35 times before you swallow it. And
just get to an applesauce consistency. Yep.
Really does that?
But
so
it's just a little bit of effort chewing goes a long way.
So I want you to talk a little bit more, Miss Tillie, about first, we're talking about a preventative, how we can treat it naturally without medicine. I want you to talk a little bit more, dive into the food part, and what are some of the natural things we can do when we start getting these symptoms that we can help to reverse GERD symptoms or acid reflux from occurring.
Absolutely. You brought up so many great little conversation points, and it was really nice to hear you go through the whole digestive process. I think it's important for people to understand that it is so complex and there are so many different phases of digestion that can be contributing. So it's not just the stomach. Like oftentimes when we're talking about, our digestive issues, everyone's thinking of the stomach, but we have so many organs at play. And we didn't even get into the liver and the kidneys and all these other organs that are involved. Even the thyroid is super involved in digestion. But just to kind of stick to the topic of acid reflux and GERD, because I think we will have to do so many more episodes all on gut health, because it really is fascinating and so complex. But when we're just thinking of GERD and acid reflux, the main culprit is low stomach acid, lack of mindful eating, and kind of just being in that stressed out state. Those are the three big culprits, but they all return back to stomach acid. And so it's important to acknowledge that even though we might be having acid come up, which is not how it should be, even though there might be a misregulation of acid being released at times it shouldn't be, it's never a case where you have too high stomach acid. The amount of cases where that occurs are so rare. Most of the time, everyone is going to reduce their symptomology simply by actually increasing their stomach acid production at the right times. So what this means is if you are approaching a meal, even if, you only have 15 minutes for that meal, even if it's, a high stress day, you need to calm your sympathetic and parasympathetic nervous system. So you need to get into that activation of your parasympathetic nervous system by taking some deep breaths. So just sitting down, closing the screen, focusing on your meal, taking 5 deep breaths before you even go into taking a bite. This already is going to set your system up so you are stepping into rest and digest, because if you are activated, if you're on the go, then your blood flow is not going towards your stomach, it's going towards your muscle and your brain. So you're not going to have adequate digestion and you're not going to produce stomach acid at the right time. So that's kind of the first element, is like setting yourself up, calming yourself down. Then the second element is activating your digestive juices. A great way to do this is through bitters. So you can really just have like a bite of arugula or chew on a piece of raw ginger. Or if neither of those are really your cup of tea, you can get a bitters tincture like bitter melon and dandelion, and you can put a couple drops into water and just drink that about 15 minutes prior towards a meal. And that's going to help really elicit those digestive juices so you're better prepared to consume your meal. Some other great ways to actually get your enzymes going, get your digestive juices flowing, is simply the smell of food. So, this is why people who cook their own food actually digest better because they're in that process of cooking and smelling those aromas. It's a very different experience than when you sit at a restaurant and the food is brought right to you and you immediately start eating before you even have that sensation of smell. Because digestion is also beginning through the nose. So, being able to smell the food, appreciate the food, calm your system down, and then starting your meal with some bitters. And like I said, I can always link some good digestive bitter tinctures in the comments of this podcast. Great way to kind of set yourself up. Another thing to consider is your water consumption. So we don't want to be chugging water right before a meal. We don't want to be drinking a lot of water during a meal because this actually dilutes our stomach acid. So it's best to kind of minimize it to only a few sips for lubrication, but really like 15 minutes before a meal, kind of sticking to as little water as possible just to make sure your digestive system is at capacity to really handle food that is incoming. If you have really slow stomach acid and you're kind of doing all these things to calm your immune system, be able to be in a steady state, eating your digestive bitters, but it still doesn't seem to really be making a difference, then something you can do is actually add apple cider vinegar into your diet. Just a tablespoon of apple cider vinegar diluted in water. Do not just consume apple cider vinegar on its own. That can put wear and tear on the esophagus. But a little bit of apple cider vinegar diluted in some water can actually really help start to build up the stomach acid. If you are really sensitive to apple cider vinegar, like if you take it and you're like, I'm not feeling good, it's likely that your stomach acid is so low, it needs more of a mediator. Like it needs a little bit of lemon juice before you go over to the apple cider vinegar. So taking baby steps to slowly build up. Something like pepsin can also be very soothing. Something like willow bark or slippery elm are also really soothing if you're kind of building up the capacity to strengthen your digestive system. So those are a few ways to kind of build it back up. Obviously, yes, it is great to cut out some of the trigger foods when you're dealing with a flare up, when you're dealing with these conditions. But I ultimately like to always return back to a place of let's get to the root cause. We don't have anyone live in a world where they have to be ultra restrictive, where they have to rely on medication at all times just to function. We want it so that you are building up your health so that you don't have to use medication anymore. You don't have to avoid all the foods. You can live your life comfortably because you have made your digestive system resilient enough to handle the moments where, maybe you are having the holidays and an extra glass of wine and some extra sweets. And maybe that can be a little bothersome, but the bounce back is what matters. We don't want that causing a 3-4 day flare up of GERD and acid reflux. We want you bouncing back the next day after you get a good night's sleep. So that's kind of why we want to build up the system and make sure you are strong and resilient.
I love that, Miss Tillie, because I come from the Caribbean and, you grow up in a place where everything is natural. If it is that you have a cold or you have a fever, you drink a cup of tea with some fever grass, or, sorrel drink, ginger beer drink, all these natural rooted drinks. This is part of our mainstay of our culture. And even when we cook our foods, we often include fresh ginger in it. So I think this is really great because I want to be able to show our listeners and our viewers that there are other options, right? I do believe that there is a role for medication.
Absolutely.
There is a role for medication, but the role for medication should be short term, right? So often we prescribe medications in the class. We call it a proton pump inhibitor. These are medicines such as Protonix, Nexium, omeprazole. All those medications are in that class. And what it does, it's a pump inhibitor, proton pump inhibitor. It helps to close the pumps in the goblet cells so less hydrochloric acid is released. And that type of treatment is very effective, especially if someone has an active ulcer. Because again, you don't want an open wound and acid being hit on that wound. So a lot of times that medication, that class of medication really help to heal the stomach. from any further assaults of it. But often there are times we have to start a patient on medication for it. But when we do start the medication, it's very important that we also teach them about the nutrition, teach them about the changes they have to make in their lifestyle, teach them about their sleep hygiene, when to lay down after they eat a meal. All those things we gotta teach them about so that in effort we can keep them short term on 3 to 6 months maximum on a proton pump inhibitor. There are times, though, there are people that may need to have it long term because there is a structural dysfunction, right?
Mhm.
And those individuals that have to be on medications as a proton pump inhibitor in long term, it's by case basis. And often we don't want to keep a patient on that long term because it has side effects. The medication sometimes could weaken your bones. Long term effects, it can cause changes in your pH, and it can cause rebound symptoms of GERD being on it for a long
Mhm.
time. And it also has been linked to stomach cancer as well.
Yeah, that's the thing that's always important to consider with medication. No matter what medication you're on, medication is an amazing tool. It is an absolutely revolutionary tool for people. How I like to view it is it's a crutch. It's that thing that's bringing you back to baseline so that you can then change your health and you have the capacity to really heal the root. Patients who go on antidepressants, some people they're hitting such a strong low. It's overwhelming that they can't think about eating, they can't think about getting out of bed, and they can't think about building up their other coping mechanisms. They need something that just elevates them enough so that they're at a baseline where they can just like return back to themselves and bring that energy forward. So that's what medication can do for people. It can absolutely elevate you enough so that you feel sane enough to then reinvest in yourself. I think where we sometimes miss a crucial piece is some people allow the medication to get them to an elevated point, but then they don't put in any effort to actually develop other coping mechanisms to heal the root cause because ultimately, it feels really good when you're not relying on medication. It feels really good when you know that you can kind of just heal naturally and heal through yourself because there are always symptoms associated with medications. But that's why it's an amazing tool. So I definitely encourage people to use your whole tool belt. Definitely listen to your provider when they're offering you such an amazing asset, but don't forget the other part of the story, which is empowering yourself and your body so that you can progress and then maybe get off that medication.
So let's talk a little bit about what questions patients should ask their provider. It's very important for you to be descriptive about your symptoms. We like to know, when did the symptoms start? How long? On a scale of 0 to 10, how would you rate the symptom? We like to know, does it occur before or after certain meals? We want to talk about what accompanying symptoms derive from it. So if it's constipation, diarrhea, belching, passing a lot of gas, if you're having bad breath or if your breath smell like sulfur, these are things that we need to know. When your provider talk to you about treatment options, we need to be not only an advocate for our patients, but we need to teach our patients how to be an advocate for themselves. So in that, you need to ask questions. Okay, what are the options for my treatment? What are the pros and cons of each treatment? How long will you be keeping me on this treatment? What are some of the signs that I need to look for that I'm healing or my symptoms are improving? And when it is, how often you're going to follow up with me so that I can inform you of the changes that is taking place.
Mm-hmm.
It's very important that we be an advocate for ourselves. We teach our patients to be an advocate for themselves, as well as us as provider be an advocate for our patients.
Absolutely. I love questions. Like, please, please, if you are my patient, ask as many questions as possible. I believe wholeheartedly in informed consent. A lot of people consent to treatment, but they're not necessarily informed about what that treatment means. And same goes whether you're getting PPI subscription or whether I'm telling you, oh, go try apple cider vinegar. Either way, you should ask about the mechanisms. I always try to explain, but things are going to be missed. Appointments are fast. Definitely advocate for yourself. Ask what is the potential side effects when you're going on a medication. Ask how long you should be on the apple cider vinegar. Like, ask the question so you understand what you're getting into, because it's so important. And the thing is, especially with a medication, I always recommend people, like, if you are going on a medication, come work with me, come work with a provider that can tell you, okay, here are the side effects. If you're going to go on medication, that's totally fine. You just want to be conscientious that there are going to be side effects and there can be nutrient depletions. There can be a lot of things going on that if you aren't taking care of yourself and kind of being aware that, that's where you can run into the problems down the line. I'm hoping we do like a whole birth control episode soon and we kind of talk about that, because that's where I see it the most, is that women take birth control, don't realize that, oh, this can cause you major depletions of this nutrient. And the thing is, you can be on birth control and still, take care of your body. You just want to be conscientious that there are things that you need a little extra support in while you're on it.
That is very important. In everything that we take as a medication, there are side effects.
Mhm.
So knowing what the side effects are and really buffering those side effects with other interventions that you can take. So for example, if we know that proton pump inhibitors, it causes a depletion in magnesium, just let's throw that
Mhm.
out there, then the provider will monitor your
Well, it does
magnesium.
actually cause a depletion in zinc, so we can go there. That's a great example.
Right?
Zinc,
So
zinc
then
is
the
what you need
provider,
for zinc is what you need for more stomach acid production. Zinc is really important for developing your hyaluronic acid, and then zinc is also really important for the immune system. So if you're depleting in that, and then also you have low stomach acid, you're not able to fight pathogens as well. So all of a sudden you're on a PPI, and then white spots on my nails, which is an indicator that you're low zinc. And then it's like, well, if you had talked to your provider, if we were able to really support you and have like effective communication, I would have said, yeah, let's put you on a zinc supplement for a little bit. Let's make sure that you're supported, or let's eat more zinc rich foods more intentionally so that you can still be on this medication, but be better supported.
and I like what you said there because it shows that there is improvement in practice that needs to occur. Because if the PPI, these proton pump inhibitors that manages, such as Nexium, pantoprazole, omeprazole, all of those that manages acid reflux and GERD symptoms, causes these depletion, then our medical providers should be checking these labs regularly. And I would tell you, often a lot of providers don't know to do the extra testing for these things. So that is magnesium, that is zinc. Often we get the CMP, the comprehensive metabolic panel. Yes, we get the calcium. Yes, we get the potassium. But I do think that the magnesium and zinc and those things are being forgotten.
Yeah, absolutely. And I will also argue that it's not always going to show up on a blood test, because that is a threshold. It's always important to remember when you're looking at vitamins and minerals on a blood test, they only determine the necessary amount based off of age and sex. But I would argue, why would someone who occupies a 110-pound body have the same zinc requirements as someone who occupies a 200-pound body? More mass requiring so much more nutrients, but the tests have not changed. They are just looking at this baseline amount. And also, everyone's needs are different. So I like to always do a bit of a preventative approach. And that's where I do think food is a little bit better than going straight to supplements, or doing more natural supplements. Like, for example, if I am looking at someone who I know based off of the medications that they're likely having vitamin A depletion, they're likely having magnesium depletion, they're likely having zinc depletion, I would say, okay, we might not know definitively whether you have a deficiency in your blood, but I do know now you are having a depletion in the amount you're receiving, and that this medication is actually reducing the effective ability to absorb this mineral. So I would prescribe either, let's eat a little bit more high quality red meat, like 100% pasture raised, grass fed meat that is really, really good for you, or doing something like a beef liver capsule supplement, because beef liver is super high in zinc and vitamin A. So that's a great way to stay away from the synthetic vitamins, but still ensure you're getting those minerals, because a lot of times that's the difference between someone feeling good and just feeling meh, isn't the actual definitive depletion in or the deficiency in their labs, but simply the symptomology of just like feeling a little bleh. So it's like that's where it's nice to utilize food, utilize herbs to kind of up your level so it's more optimal.
Wow, that is amazing, Miss Tillie. A lot of us don't even medical providers don't even know that information. And I think this is what the people needs to hear. This is what you look at social media, you look at the news, a lot of people want natural options. They are seeking it out. And I've had patients who told me that they asked another provider, another doctor, why can they do this naturally? And sometimes they are being scared that, oh no, you can eat whatever you want. There's no natural benefit, and it's because there's a level of ignorance. Because even a lot of medical schools, even nurse practitioner schools, even pharmacy schools, a lot of times they don't have this knowledge of natural diet and nutrition embedded in their school
Hmm.
programs. So a lot of providers are out here learning it on their own when they go to annual conferences within their disciplines or continuing medical or nursing education. That's how they're learning this information. So, based on what we discussed today, we talk about the symptoms that you may present with acid reflux and GERD. We talk about the mechanical changes in your body that causes these symptoms. And we talk about treatment options, both natural and medication wise. Before we end our program today, I really want Ms. Tillie to really give top three things that our viewers who are watching this program can do if they suffer already with acid reflux or GERD, if they're passing a lot of gas,
Hmm.
abdominal bloating, and they have bad breath where they have that sulfur breath smell. Top three things they can do to live a better life.
Love it. Okay, top three things I would say. Number one, calming the nervous system. I don't care what you're doing, how long you have for lunch, just sit down, take a couple deep breaths before you begin. That is going to be revolutionary, even though it seems so trivial and small. 5 deep breaths before your meal. Second one is chewing more. So, really getting in there, chewing your food. Not only is that allowing more digestion to occur in the mouth, but it's allowing your stomach to produce more stomach acid. Number three, beginning your meals with a bitter. I always love just kind of telling people raw dog some arugula. Have arugula handle, take a handful, throw it in your mouth. It doesn't even need to be a whole part of your meal. Or it could be chewing on a little piece of ginger, which I know can be pretty spicy for some. That's why I do like the arugula option, or doing a digestive bitter tincture, which again, I'll link. There's a couple good ones, but those are your best options. And I just want to remind people it's meant to be bitter. Like it's not supposed to be masked and be sweet. Like it is supposed to be bitter because it's really that sensation of bitterness that creates the mechanism to produce the stomach acid. So those are my three. Approach your meal in a calm state, take 5 deep breaths, chew as much as possible, and start your meal with bitters.
This is great because, as we nearing for Christmas holiday and New Year's and all the family gatherings, you know, make sure when you go to the store, buy a bottle of apple cider vinegar. Make sure you buy your salad and pick arugula, and fresh ginger root. A lot of our a lot of our markets have it. It's in our big superstores like Walmart, Target, all the grocery stores. You can get fresh ginger root. And I am so happy to share this information with our viewers today, Miss Tillie. I think this was wonderful.
This is excellent. I just want to wish you all a happy holidays, whatever you guys celebrate. Remember to enjoy yourself. Remember to eat slowly, eat mindfully, and really be present with your meals, because meals that are enjoyed have a completely different experience in your body than meals that are riddled with guilt and disdain. So definitely go out there and just give yourself a little bit of love through the foods you eat.
Wow. Thank you so much, Miss Tillie, for that. And I want you all to stay tuned because our next episode has to do with, New Year resolution. Everybody wants to be healthy, focus on wellness and weight management, so stay tuned. Thank you so much, everyone. I am Dr. Marshalee George, and my co-host is Miss Tillie Mirsky. And thank you for watching us on another episode of Health Talks by YWS.
Thank you, guys. Bye.
Bye.
Come on, work it out. What? Come on, work it out. Come on and work it out. See, health is wealth. Come on and work it out. You at the gym right now. Come on and work it out. See, health is wealth. Come on and work it out. Yeah. Come on. It's about you and me. Let's come together. Positivity. It's about me. Health is wealth. Gotta take care of myself. 'Cause ain't nobody gonna make the change but me. So let me put in the work.